Hi everyone, and welcome to A&P with Dr. O. This video is going to take a look at the heart again with a different model that we have available to us. And there's a couple of structures that this heart model is going to show that we didn't really get to see on our other models. Let's go ahead and kind of get our bearings. We've got our right atrium, our left atrium, left ventricle, and our right ventricle. We have our aorta, ascending aortic arch, descending aorta. We've got our superior vena cava. We have our pulmonary trunk. Here is our left pulmonary artery. And then underneath we can see the left pulmonary veins. We'll go ahead and take a look at the inside now. Here we have the inside of the heart. Again, we've got our right atrium, left atrium. That means that this is going to be our bicuspid valve, and our left ventricle. Between the right atrium and right ventricle is our tricuspid valve. We can see our cords, the chordae tendineae. They are attached to these papillary muscles. So those attachment points are to the papillary muscles. I have the model tipped up so we can see the pulmonary semilunar valve. And then let's go ahead and tip it up again. And then we can see the aortic semilunar valve. If we focus in on the right atrium, we can see the fossa ovalis right here. Again, if we think back to the fetal heart, we have an opening between the atria called the foramen ovale. At birth, it closes and forms the fossa ovalis. And then we can also see, so again, here's our fossa ovalis. We can also see the opening to the coronary sinus. We go ahead and turn our model. We can find the coronary sinus here. All of the cardiac veins are going to drain into the coronary sinus. And then blood from that coronary sinus is going to enter the right atrium through this opening. On this model, we can also really nicely see the interventricular septum. And if I kind of turn it again just a little bit, the wall between the atria is going to be the interatrial septum. So our inner atrial septum separates the atria on the inside, and then our interventricular septum separates the ventricles on the inside of the heart.